Meeting of the Mecklenburg County Board of Supervisors to order. I would ask that you please mute your cell phones during the meeting so we won't have those interruptions. As you well know, we're still under the COVID-19 restrictions here in the county, so we are limited to in-person meetings with our citizens, and we certainly are sorry for that. We look forward to having you folks back in here with us in the near future. At this time, I would ask that you stand for the pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You have in your packet the minutes from the January 11th meeting. Please take note that the calendar has been amended. So if there are no other changes, amendments to the minutes, the board would entertain a motion to approve the minutes as amended.
Mr. Chairman, I motion to approve the minutes as amended.
Motion to approve the minutes. All in favor say aye.
Aye.
Opposed? Thank you. Also, you have before you our agenda for today's meeting. I do have one addition. Make it item E1. We'll hear from our school superintendent, Mr. Nichols. That's all the changes that I have. Anyone else have anything they wish to add to the agenda at this time? If not, we need a motion to adopt the agenda as amended.
Mr. Chair, I so move.
Motion to adopt amended agenda. All in favor say aye.
Aye.
Opposed? Thank you. Our first order of business this morning is we're pleased to have Dr. Spillman with us, virtually, of course, as for an update on our COVID. Jenny, you handling that?
Dr. Spillman, are you there?
You bet. Is this, I can, I'll put myself on video if that helps. And I've taken myself off mute. Are you ready for me?
Yes, sir.
We're ready.
All right, well, good. First of all, thank you all for allowing me to speak briefly. And I want to thank Mr. Carter and the board for giving me the kind of first up, because I have Monday as a day of meetings and other types of things like this. And I appreciate your accommodating my time. I want to talk about the cases of COVID so far. We'll talk briefly about Virginia. Let's see, cases, in the Commonwealth are 529,125, 22,102 hospitalizations, and 6,778 deaths. This is as of yesterday. I don't have today's new metrics just so far. The 7-day positivity rate, which is PCR only, is 10.4. And that's it's still up there for the state. There are 2,387 outbreaks in the state of Virginia. Now for Southside, there as of yesterday, 5,135 cases. Half of those are in Halifax. 166 people hospitalized. 111 deaths. Roughly almost half of those are in Halifax. 57,216 PCR tests, and all tests, including the other rapid tests, are 73,736 tests. The 7-day positivity rate is 7.8, which was up a little bit from the day before, but quite frankly, it's below 10%, which is a very good sign. Even if you take all of the tests, it's still below 10%. Now, in terms of in terms of vaccinations, so that's what we're facing on the front there. In terms of vaccinations at the state level, 1,438,175 doses have been received. Vaccinated at least one dose, 876,778. It doesn't distinguish Pfizer versus Moderna here. Second dose administered in the state, 195,970 for a total of 1,072,748. Now in Southside, the first dose, I'll just stick with the Mecklenburg statistics, 3,827 doses, and in second doses, 533. Now, the health department has vaccinated the hospital, and then in addition, we've distributed vaccine to some other providers who have also been vaccinating, and so that's how many we have done. I can give you the Halifax and Brunswick if you want, but the lion's share of these first doses have been in Mecklenburg. So that's the basics right now. We have been using a CDC-based system called Vaccine Administration Management System, or VAMS. That is the system by which people register, find a clinic, and give health information. We also use that as a documentation system and sometimes a scheduling for the next clinic. The positive about that is that CDC provided it. There are many drawbacks, however. It's difficult to use, and the other drawback, which is affecting us more locally sometimes, is that once a clinic is listed, it's open to anybody who wants to try to find it. And we do not have any control over that. And you say, time I have hundreds of miles to get a vaccine, who comes from a different part of the state or even a different state can come in and have a spot that would otherwise for our local, that we have to vaccinate them. We've tried at times to contact the people, help them find a clinic closer. But for those people that truly want to come, by law, we cannot turn them away. So we get people from other counties in Virginia. We get some people from North Carolina. We've even had people in the Danville office that have come from South Carolina. And then in other parts of the state, they've come from Tennessee, West Virginia, Maryland. And so that's very frustrating for everybody. We are going this week we start learning about a new system that Virginia Department of Health is getting called PrepMod, PREPMOD, and that's one word. That gives us more ability to have a vaccination clinic that we can truly control who gets the links. What we cannot control right now is what the people do with the links. For instance, we can send out to a specific number of people, or we'll be able to, this link what we found in account for what people do with it afterwards. The people that have PrepMod and the Virginia Department of Health are trying our best to work around that and get the system modified as best it can. Now, we have a thing called a pod, which is a CDC term. It's all capitals, POD, and it stands for point of dispensing. And that means when you come in, you get we dispense the medication to you at this point in with a needle. So we have gradually built up our vaccinator army, and Mr. Carter's helped us find some vaccinators inside Mecklenburg County, and we're grateful for that. And the main limitation we have right now is that we don't have enough vaccine. I have been lobbying almost every day to the central office to give us more vaccine. I have asked for an additional 1,500 doses per week for Southside. We did get some extra doses last week, but those are almost all consumed now. The idea is that we don't keep them on shelves, we put them into arms, but we have willing people, we have some willing vaccinators, and all we need is the vaccine. When will that get better? Right now, we're told somewhere in March it should start getting better. It won't be probably before mid-March, could be April. And I'm just, it depends on how fast Pfizer can step up their vaccine production, Moderna, and which both require 2 doses, and the other, the Johnson & Johnson, that's a single dose. That could be a game changer for us for some things, because right now, for every one person, we do 2 clinics, right? So that would be very helpful to only do a one-off, one and done. The Pfizer, as you might remember, requires what's called ultra cold storage. It's minus 70 degrees Celsius, which means it's about 90 degrees below 0 Fahrenheit. And they have very, very rigid times and means of handling it. The one that we've been getting is a little easier to handle and a little more forgiving, and that's called Moderna. And it still requires freezing, but it gives us more options about how we store it, much more like the flu vaccine, and a little more flexibility about how we keep it out and administer it. Even refrigerating, if we've thawed something, we can't refreeze it. We just keep it in the refrigerator, but we have some time on that. It's our objective to never waste even a single dose. One of our challenges is that some of the bottles have had fewer than 10 doses. Sometimes we get as few as 7, and we occasionally get 11 doses, and we're trying to account for that in our in how we report back to the CDC. So it's being watched dose for dose, day for day. And we go to Mecklenburg, because of our staff limitations right now, we go to Mecklenburg on Fridays and do the vaccinations. Because the vaccine is put into our stewardship, we are required to either have people who are helping us come to our clinics, meaning we cannot just give them the vaccine, they have to come help us, or we have to do something called a redistribution, where we actually send the vaccine under the cold storage chain to another place that has cold storage and meets the CDC criteria. Then it's their vaccine. We've done that somewhat with some of our distributions, and to some degree we can have the state VDH distribute it directly to some places. For instance, some of the healthcare providers. VDH and CDC are working with other places like CVS to increase the availability of vaccinators, I should say, vaccination stations, times and dates. Right now, CVS and Walgreens are under contract federally and with the state to go into the nursing homes, skilled nursing facilities, long-term care facilities, assisted living facilities, and to give all of those people their 2 doses. That's the residents and the staff, whoever will take it. It's not a requirement that people take it. Pardon me. What they're doing now, they're starting to pilot. I say starting because it hasn't actually begun yet, but will this week. Selected sites throughout the vaccine, and those sites will begin vaccinating on a daily basis. Right now, I don't think there are any in Southside. There are probably, I haven't looked to see how close the other ones are, but there are only a couple of dozen of these sites in the state. And they will expand that over time, again, as vaccine becomes more available. We are focusing initially on 1A, and we're almost through vaccinating those people twice. There are some people in 1A that have not come forth for their first or second dose yet, excuse me, and we're working on that. We are focusing on 1B. The highest priority are our fire, law enforcement, and hazmat, and our seniors, 65 and over. It was 75 and over, but the governor has allowed us to do 65 and over. We are also eventually going to focus on people below age 65 with chronic health conditions. Right now, we're just trying to get vaccine into the arms of the people most at risk. Most at risk, meaning people who will become very ill, go into the hospital, occupy an ICU bed, maybe a ventilator, and die. And we're trying to minimize that. And of course, any death in a family is one too many, and that affects the whole family. We are also beginning on our teachers as soon as we can. I don't remember if any of your teachers in Mecklenburg have been able to get vaccinated yet. I didn't check with Julia on that, but we will start that as soon as we can. So we say teachers, it's public school and private teaching and childcare workers. That's a large group. Now, 1B category occupies about 50% of the total population. So that's a large group, and so we're working through that. And of course, once we finish that, we go back again. The more vaccine we get, the more vaccinators we can use, and the more clinics we can have. It's just that simple. So we are getting to people as soon as possible. I understand that, just like I told you, some people with this type of vaccine management system are able to come from other states. Our citizens, our community citizens, can go to other places and get that as well. So there are people back and forth across the border or in and out of towns. Again, the PrEP mod will help us manage that a little more tightly, which is we hope will give us a greater opportunity for the citizens in Mecklenburg County to be first in line for the vaccine and not have to wait for somebody from another state. I'm happy to answer questions.
Anyone have any questions for Dr. Spillman? Dr. Spillman?
I can hear you barely. I'm not sure who it is. If there was a way to speak a little louder, please.
I'm sorry, didn't.
He said, speak a little louder.
Oh, can you hear me now?
Better. Thank you very much.
Is that better?
Who is this?
I guess.
Yes, sir. It's better.
Yeah. Do you have any way?
Who are you? If you wouldn't mind, tell me.
I'm sorry. This is Glenn Barr. I'm chairman of the board. Can you hear?
Okay. Thank you, sir. Good morning.
Okay. I was just going to ask you: is there any way that you can guesstimate, or based on data that you have currently, what percentage of the population do you think will ultimately take the vaccine, on a voluntary basis, obviously?
That's an excellent question. I'll tell you what we see, and I'll tell you what my hope is. So right now, people started out no more than about 30%, but as the vaccine arrived and people were getting vaccinated, and the rest of the group said, "Oh, they're not dying from it," we another third, or 65, 67% of the people have said, "Yes, I'm going to take the vaccine." And we think that there are going to be more to join in. I'm hopeful that we will get 80% or more before it's all over with. There will be some people who will want to be last in line, and that's fine. There are people who want to wait till everybody else is vaccinated. So I'm hopeful that we will get 80%. Now, if we can get that number, that will bring us close to what, and you've heard Dr. Fauci talk about this, to what in public health we call herd immunity. If you think about vaccinating cattle or other herds of animals, and we're not the same animals, it's just a term. But that means that there are enough people vaccinated, so it minimizes the ability to spread to those unvaccinated. So there's a bit of those that have been scattered, would be scattered in the general population that got vaccine, and that would minimize the risk for them. Now, there's some people who cannot get the vaccine. For instance, below age 16, there have not been clinical trials on children for this because it was so new, and so they're not up for vaccination. They also tend to weather the storm a little better. The other is those who are pregnant. There's not been studies done on those groups yet, as you might imagine. So it would help protect those types of groups. And there might be some people that their doctors recommended them not to get a vaccine. And those might be the most frail of all of our community members. So we're trying to get as close to a good herd immunity to protect everyone.
Okay. Yeah, 80% sounds, that's a lot higher than what I had heard in reading some other information on that. Anyone else have any questions?
It's a hope. It's certainly a hope, not a guarantee.
Right.
We have 3 minutes. She's got to Dr. Spillman, this is Tom Tanner from the board. Right now, what is the best way for somebody to go to sign up to get on the list to be vaccinated? I know you were talking about 2 different websites, and
that's another. Yes, that's an excellent question. We currently have put up a survey, a sort of a waiting list survey. You can get your name. It's not a schedule for an appointment, but it is a list from which we can draw to search for people in certain groups. Because we're vaccinating by category, not by occupation, primarily right now. Category 65 and older, not like an occupation would be, say, a grocery store worker or an over-the-road an over-the-road driver or something. We will want to get to those as soon as we can. So how they sign up on our website is if you go to the Southside Health District website, and there is a specific link that you can, and it will ask you a few basic questions, and it should only take a couple of minutes to do. And then when we go to get people scheduled, we go back to that list. Now, people have been calling and giving information. We will take that information into account as well. The problem with the calling, that we found out, is there's so many phone calls, it actually shut down our phones. It crashed the phone system in all our health department offices many times. So we put this up, and we think that this is going to be the most helpful. So that would be the best way. And as we look for more people to vaccinate, we'll go to our phone list that we've already got, and we'll go to that website and pull the names by category out of there.
thank you.
Anyone else?
Thank you.
Dr. Spillman, we really appreciate your time, valuable information that you have given us, and we just hope we can get more of that vaccine and get more of our folks vaccinated as soon as possible.
Yes, sir. Yes, sir. Now, there is one other thing. Sometimes I get asked, well, what can a board do? And so I'm going to say, if you write to whoever your representatives are and say, please help us get more vaccine. We need more vaccine. Sometimes that can have some influence. Otherwise, we appreciate people's patience and support. I greatly appreciate all the support you all have given us. And Mr. Carter's been great to work with. So I want to say thank you. It was a pleasure. And happy to talk to you another time if needed.
All right. Thank you, sir. You have a good day.
Thank you very much. You too. God bless everybody.
God bless you. Yes. Okay. All right. That was some pretty interesting. I was a little surprised at that 80%. I don't know about you all. I'd heard numbers as low as like 60. So 80%, that'd be,
I think that's wishful almost.
well, that'd be awesome. I hope that works out.
I know some people that said they're not gonna take it,
I know.
and I just shake my head. But they're the same type of people that don't get pneumonia shots or other
Oh, yeah.
vaccine shots.
Yeah. Okay, next on the agenda is proposed ordinance for adoption having to do with continuity of government. Mr. Slayton?
Yes, sir. You have adopted this ordinance previously. It's supposed to be readopted every 6 months, so we need to do that, and I recommend you do it. It basically confirms that you will comply with FOIA and procurement, which you always do anyway, and that you will comply with the governor's executive orders, which you always do anyway. The benefit of this, it enables you to do things like these remote meetings and virtual meetings. So staff's recommendation is that you adopt this ordinance.
All right, anybody have any questions concerning the ordinance?
Move to adopt the resolution, Mr. Chairman.
We have a motion to adopt the resolution. Any discussion? All in favor of the motion, say aye. Aye. Opposed? Thank you. Let's see, okay, we have Tanya Edmonds here with Southside Center for Violence, wants to talk with us. Welcome.
Well, I'm not Tanya Evans. Good morning, everyone.
Good morning.
My name is Patty Farrar.
Patty, pull the mic down and speak into it.
My name is Hattie Farrar, and I am a board member for the Southside Center for Violence Prevention. It is an agency of Madeline's House, which is for domestic violence of the Southside Center, and also SAVE, the Sexual Assault Victim Empowerment Program. I want to thank you all for giving me an opportunity to speak to you this morning and also for your continued support. I would like to share with you our efforts in 2020. We continue to provide free and confidential services to include counseling and crisis intervention, advocacy and accompaniment, and education, resources and referrals, and shelter to victims of dating, domestic violence, and sexual violence, such as sexual harassment, sexual assault, and sexual trafficking. We continue to provide these services to victims who reside in Mecklenburg County. In 2019, Southside Center for Violence Prevention had a total of 144 calls to the hotline. They provided 365 advocacy services. They provided 83 nights in the shelter, 83 victims in the shelter, 3,322 bed stays. They made 384 contacts. Total hours of service was 863.95. In 2019, for Mecklenburg County, of those numbers that I just recited, 8 of those hotline calls were from Mecklenburg, 4 advocacy services, 2 in the shelter, 120 bed night stays, 53 contact hours, and 55.75 hours of services. In 2020, the total for services provided by the Southside Center for Violence Prevention was 97 hotline calls, 66 advocacy services, 45 was sheltered, 1,680 bed night stay, 321 contact hours. Total service hours was 507.15. For those in 2020 for Mecklenburg County was 3 hotline calls, 3 advocacy services, 2 was shelter, 52 bed night stays, 16 total hours of services. In 2021 to date, so far, that shelter has provided 92 hotline calls, 47 advocacy services, 35 has been shelter, 1,518 bed night stays, 296 contact, 224.5 hour service. So far in 2021 to date, Mecklenburg County has used 4 hotline calls, 2 advocacy services, 5 have been sheltered from Mecklenburg County so far in 2021, and 260 bed night stays have been used for Mecklenburg County. 10 contact hours and a total of 5.25 hours have been provided for services. As you remember, last year, we expanded our therapy program by having all of our clinicians, clinical staff trained and specifically in play therapy. We expanded our food donation program to community clients and established ourselves in a facility for sheltering animals along with the families. This year, our efforts to continue our strategic plans quickly was halted and shift to COVID-19. While many businesses closed and shift to online services, we have victims living in our shelter. So we were unable to take that route. We were forced to find ways to improve our facilities and practice in a way that allowed us to continue to be safe as well as the victims. For example, we usually have 24 beds available, but with the pandemic, we no longer allow individuals to share rooms who are not family, limiting us to 7 rooms. We were unable to keep our doors open for most of the pandemic, though we had an initial limit of numbers of clients we had to limit clients to 5 people to abide by the state restrictions. And we had to close temporarily for a few days when there was a suspected case. In those situations, we were able to offer hotel stays or refer to other shelters. Additionally, because we knew it was difficult for clients to be able to house hunt during that time, we lifted our 30-day restriction and provided more extensions to their stay. In addition to our shelter services, we continue providing counseling, though we had to temporarily stop offering support groups for safety reasons. As you may remember, we had a clinical psychologist on our staff. As she had not been formally trained in school to provide telehealth services, she and one of our master level clinicians both completed an extensive nationally recognized program in telehealth and did exhaustive research on telehealth platforms. For our current clients, we could not continue to engage in face-to-face services because of COVID. We were able to offer a transition to telehealth services. We also continue offering advocacy and accompaniment, such as accompanying victims to hospitals, court, and other appointments. Unfortunately, there were times when appointments and/or our accompaniments were limited by the other facilities due to the COVID restriction, in which cases we provided a complement to the office parking lots of those facilities. The most significant change to our service was our education and our outreach program. With the pandemic, all festivals, fairs, and events were canceled throughout our counties. So we did not have the opportunity to table with our outreach material or to present to groups on violence and prevention. Our outreach staff used that time to create materials for individuals and different groups such as first responders and teachers, and to keep a presence on social media. We look forward to hopefully being able to resume services as normal in 2021. And again, I thank you all for giving me the opportunity to speak to you all this morning. Thank you.
Thank you. Anybody have any questions or comments?
As you all will remember, Madeline's House had said that they were going to drop us, but they are continuing to provide services for us. We've also got services expanded through Tri-County, so we have 2 organizations providing these services to our citizens.
Okay, all right. Very good.
Thank you. Oh, that's right. Oh, I'm sorry, I didn't introduce.
I also work at Madeline's House. I'm the new Forensic Advocacy Program Director. Hattie said most of it, and I really do appreciate your support because it's been a difficult time with COVID-19 going on, and y'all's support helps us going. I just wanted to add, we do have a new satellite office in Mecklenburg County, so that way if any victims need community services, it's a public space. We can meet there to help them with job searching, counseling, case management, management and all of that. If you do want the address, it's 119 West 7th Avenue in Cambridge, Virginia. They can just call our hotline or call our office, and we'll set up a time and date to meet with that. And we're also looking to house men as well, as they're victims of domestic violence and sexual assault also. Unfortunately, we can't house them with our females, but we do have to find a shelter, and we're actually looking in Mecklenburg County to do that. So if anybody knows of any possible spaces that we could do that for a discounted rate, or if it could get donated, that is something we're trying to do to expand our services to reach out another community. That's all I have.
Okay. Well, thank you all very much.
I do have one question. I'm glad that there are three groups that are working with Southside, Center Valley, and the Madeline House and Tri-County. How are the 3 working together, and when a Mecklenburg citizen has problem, who do they call?
Okay, it's just 2 groups. Tri-County, principally, I use them since I'm the main person here in Mecklenburg County that works with sexual assault and domestic violence through the Victim Witness Program. I use most of the time my referrals, and also keep in mind that individuals and victims call on their own also, because they do have I make sure I get the information out in the community, and so they have the numbers to both of those agencies. But when I'm making the critical decision, I give them the choice, because most of the time when I meet people where they are, it is generally an emergency and a crisis. So I try to get them to the nearest place. So most of the time on the western end of the county, unless there is some immediate danger, we may refer to Tri-County. If we're on the eastern end of the county, most of the time we refer to Southside Center for Violence Prevention, but we use both of them, so it's no set rule that we go by, because sometimes we need to get people as far away as possible in order for them to be safe. Being safe is the decision that we use in placing any of the individual anywhere.
Okay. Thank you.
Mr. Carter, do we have a link on the county website that connects to this under the health services?
Not that I'm aware of, sir, no, sir. We are working on the new website, and we can have that in there. Currently, those calls are all routed to Hattie.
Victim Witness is on the county website.
Right, and she's the one that handles all that.
Okay.
They go through Hattie. Everything goes through Hattie. So that's why she's there. We don't have separate links to their facilities, because she also makes sure that they get all the different help that they need, and she can get there immediately.
That's correct, 24/7.
Okay, well, thank you very much in bringing that report to us, and we certainly appreciate the service that you all provide. It's unfortunate that we have to provide these services, but thank goodness we do have them, so. All right, next on the agenda, we have COVID dashboard, Chad Neese.
Thank you, Mr. Chairman. As you noted, my name is Chad Neese. I'm with the Southside Planning District Commission. At one of our recent quarterly meetings, we did this presentation, and Supervisor Tanner asked that I come to the full board and share that with you. Thank you. So as part of the ongoing COVID-19 projects at the PDC, our executive director, Deborah Gosney, and our contract staff, Ann Taylor Wright, had expressed an interest in having a data dashboard. Specifically, they wanted to share key health and economic data as we're going through this pandemic situation. So we're going to display the data from a regional standpoint, meaning we're going to have Brunswick, Mecklenburg, and Halifax included, but we also break it out to show the differences between the three counties and the similarities. We're taking it, we've linked it to the website, that way it can be shared with the public, anybody can view it. And again, we're compiling a bunch of data and resources from, respectable places like the CDC, Virginia Department of Health, the Weldon Cooper Center, places like that. We're just kind of combining it together in one little information hub to make it easier for folks to at least have a good starting point to find the information they're looking for. So let's see here if we can take you briefly through this hub. So here's a regional overview. We have a few data boxes here. Again, this is region-wide COVID-19 data, and to follow on the heels of Dr. Spielman, the fully vaccinated box that you see here is people that the Virginia Department of Health has reported as being fully vaccinated, irregardless of however many shots they received and which one they did receive. But again, that's just some ongoing information. This is updated usually on a daily basis. We also have some regional economic data in regards to the unemployment rate, claims, local sales tax, and the like. As you continue to scroll down, this is the actual data dashboard itself. And we have it set up for each county. You just click on the tabs down at the bottom to get it to change to the county that you desire to see more information on. This is the unemployment rate. And if you click in the top right corner, you can get it to go to full screen, maybe for a little bit easier viewing. And again, click in the right corner, it'll minimize back to normal. In the top right, we have a couple data indicator boxes. And again, you can cycle through these to get to the county data that you're looking for. And again, we update these on a very regular basis as well. COVID-19 funding, these are links to more information on the PDC website regarding any sort of small business recovery assistance funds. Same thing with the COVID-19 emergency loans. We also have a link there. The symptoms, this is part of the template that we utilize through Esri, our GIS provider. This was in there. We have reviewed it to make sure that there are that it's as up to date as possible. We're not the health officials. We're just trying to share good common sense information with everyone. So again, here's some things you can do to help prevent illness. As we keep scrolling down, we have also embedded the Virginia Department of Health COVID-19 testing sites. I'm going to allow that. And so with this embedded page, you can, this page is still fully interactive. You are actually working on the Virginia Department of Health webpage when you're in here. So with the testing sites, as you scroll down, it'll automatically load based on your location. So you can either click on the map and see where testing sites are in your area, and you can learn a little bit more about them over here on the left. We did something similar with the COVID-19 vaccine information. We also embedded the Virginia Department of Health webpage, again, fully functional, and folks can go there to find out more information regarding the vaccine and how it may impact them. As you continue down, just a few additional resources through the CDC and some frequently asked questions. But again, the main driver behind all of this was to compile data. Whoa, excuse me. Back up here at the top. So things got really loud there. Sorry about that. Does anyone have any comments or questions? This is a link I've shared with Supervisor Tanner. I can certainly share it with Mr. Carter as well, or any of you. But again, this is located on the Southside Planning District website. Let's see here. If you just go to the COVID-19 menu item, do the drop down to Information Hub, you can access all that information at your leisure.
Very good. Good information, good tool to have for us to take a look at. Anybody got any questions? Okay.
Mr. Chairman, I just want to thank Chad for coming this morning. He did an amazing job with the presentation the other night, and it's just a lot of information on it that I think citizens and anybody else could use, from the vaccinations to the testing sites to anything like that. And there's a lot of other information on the Planning Commission's website also. They also host our GIS for the county, so they have a lot of useful tools, and thank you for coming.
And we even went through different scenarios of putting it in the search, Google search, and it popped right up. So it's easily accessible.
Okay. Very good. Thank you very much.
Thank you.
Mr. Chairman, I'm going to comment another on Dr. Spielman. Made a suggestion that Mecklenburg County what could Mecklenburg County do, as you questioned? Would it be in order to make a motion that Mecklenburg County will send a resolution to petition for more vaccine for this area? Or would that?
Well,
I had thought the same thing, Mr. Chairman.
well, we
Never
can.
hurts to ask.
No, it never hurts to never hurts to do anything like that, Mr. Spain.
In the form of a motion that we send a resolution.
All right. So Mr. Spain has made a motion that we adopt a resolution and send it to our state representatives. Is that
Yeah, to the person.
requesting that Mecklenburg be considered for more vaccines? Is that
That's the
okay?
motion, yes.
All right. Any discussion on that motion? All in favor of that motion, say aye. Aye. Opposed? Thank you, Mr. Spain. Okay, Mr. Nichols, our superintendent is here this morning to give us an update.
Thank you, Mr. Barber.
Welcome.
Representatives of the board, give me a minute to get back to my presentation. So I will say that as far as the new building is concerned, we are moving right along. We are very thankful that there has been no impact of COVID on the builders. If anyone has had a chance to, or has had the misfortune of being sick by it, they've had others that have come in to work. So the work continues very quickly. As you can see on the screen, we're going to go through the similar information that we do each time. This information is being provided by Skanska that has been hired and is doing a tremendous job of working with us on overseeing the construction as it goes along. Current progress is on steel erection, which is in full progress. First floor of the high school is nearly complete. They're beginning to lay foundation for the middle school component of it. You will see in a little bit that we've also got some progress is being made in the auditorium section. Light gauge metal framing is in progress in the cafeterias. Roofing is in progress on the auxiliary gym. You can read through. Mecklenburg Electric is on site working to make the connections for permanent power. The force main is in progress. Some of you have seen the piping going along for that as it's being connected to Boyden. We're very pleased to see that part in place. And there have been no current delays in material shipments. Final completion is still expected before we get through. I want to point out final completion means the fields and everything. We will be looking for the buildings to be ready much before this so that we'll have time for being able to move the materials in for the students to be coming in place. Permanent power is in progress. The auditorium slab will begin this week. Roofing on the gyms will be coming in February 21st, and then the complete brick veneer on the CUP building should be already in place. It's not quite there because we've had some more bad weather. Construction budget right now, that's just for the construction, is 114. That's come down significantly. A good component of that reason that it's come down is because we continue still to do a direct purchase of all the supplies through the school, and of course that's tax deductible, so we're saving on those taxes. So we're very pleased with that. To give you some updates from pictures, this is the latest aerial view of the site. You can see the concrete being poured on the middle school area, and then buildings. Actually, they've got some of the flooring for some of the second floor in place over that high school part, and then the roofs going in on the gym facilities and cafeteria facilities. This is one of the pictures that I took recently with the drone coming from the front. You can get a better sight up close. And this one, you can see the yellow that has been put down on some of the area that's going to be not paved, excuse me, but the concrete's going to be going down for the auditorium. And that's going to be a tremendous benefit for the whole process and for the community. Mechanical curbing is being set on the roof and the middle school gym. That will be carried over to the high school gym very shortly. So we're getting some completion on those. These are some of the framing on the edges of the building for the sites that's been totally put in. That's why you see so much of that big crane being used every day. It's in place. This is the auditorium. You can actually see the stage area and then the seating area for the auditorium that's in place, and we're very pleased with that. This is another view of it from one of the wings. This is a side view as you're looking across to the parking lot and on up into the bus areas and so forth. So we've made a huge amount of progress. Very thankful for that, and I do want, though, to also move into because I know there are a lot of questions about our impact of COVID on our schools. I'd like to point out that for the full first semester and back into last year, the primary guideline that we had to go by for when it was safe for us to have students in school was solely focused on the COVID spread in the community. And we always use that terminology of green, yellow, orange, or red. We have new guidelines from the Department of Education and the Virginia Department of Health that is a five-fold issue that we take into consideration. And at the time, I know many of you were aware that when I was last here, I specifically said our goal is that in second semester, which is to start February 1st, we would be looking to have all of the students whose parents are choosing to come back in on a schedule to be able to do so. Well, with these guidelines, that looked to give us more option to truly be able to do that. But then when you look at number 2 and number 3 on here, there were two specific issues. Number 2 is still looking at the level of community transmission, and then number 3 is determining the impact on the schools and what's going on in the schools. And with those in place, I'd like to go on and show you that the daily cases recorded in Virginia continued to go up through December and January. And as you look just at Mecklenburg County, and of course we've been looking at this data all morning as we've had the conversations, but toward the end of January and into the first part of February, we actually had the highest cases that we had had at all. And it also impacted a significant number of our teaching staff. This is showing you from December through the 1st of December to the end, the actual impact on our county. And the red line actually is the line that the state was using to say, when you move above this, that you should be having all students virtually learning. That is right at 25 per 100,000 in the community. On the 12th is the day that we actually look to move students to full virtual learning, much to our chagrin, because we know the impact that it has on it. We were very hopeful that we would see the number go down significantly 2 weeks after Christmas, and in fact, on January the 12th, we began to see a significant decrease. I don't know what happened, but it looked like right after January the 12th, the numbers just continued to go up. And by the 31st of January, you can see they were as high as they've ever been. Additionally, you can see that the impact on our employees and students was highest that it had ever been in January. And we keep track of this because we've actually had our nurses in each of our schools trained to do the contact tracing. So that information comes to us continuously. And of course, through Christmas, everybody was together. That had an impact. And then you move on to look just at those that are quarantined. You know, it's a difference in having COVID and being quarantined because you've been exposed to others. Well, those numbers also went up significantly. So bottom line, when we came to the week before second semester was to begin, we were not in a position to be able to open the doors as we had hoped because the numbers were so high. They have since then dropped off. In fact, we are right on the edge of being in the orange by the numbers that we've been given. And we have had a significant meeting, and we will be moving on the 15th, which is next Monday, to having our students come back in whose parents have chosen for them to come face-to-face, with elementary meeting every week, Monday through Thursday, Fridays being virtual days, because we still have approximately 30% of our students whose parents are choosing for them to be full virtual. At the secondary level, we have still a need to keep up with the guidelines that the state has given us about the numbers of students that are available to ride buses, which is still a third of what they used to be. No more than 21 on a bus. We have still most of our bus drivers that are over 65, that some of them have had significant concerns about driving. And then in our classrooms, we are still required to have students at least 3 feet apart wearing masks. And so that's put us in a position at the secondary level that we're having to move to an A-B weekly schedule, which means half of the students will be coming into secondary on A week and then the other half on B week. Instruction will be continuous through that time, but they'll go shift back and forth between virtual and face-to-face until such a time as we get some more guidelines that allows them to come in fully. We're looking for that. We're going to continue that way, and after the 15th, we will use contact tracing to actually identify any persons or classrooms and possibly schools, I hope not, but individual schools that we would quarantine and say that everybody at this particular classroom or whatnot may need to be away for a couple of weeks because of exposure that's there. We're going to watch that very carefully. We have huge safety mechanisms in place for cleaning, hand washing, wearing masks, all of those things. And we have evidence in our own elementary at the time from first semester that we never had any spread caused by being in school. We had a lot of spread outside of school that had an impact. 4 classes among the elementary schools actually had to be quarantined for 2 weeks, but they'd come back. So that's the way we will be moving forward. And we're very pleased because even though Dr. Spillman was unaware, many thanks to Wayne, many thanks to Sheriff Hawkins, we were able to get 200 vaccines and have a clinic last Saturday for our teachers, 200 of our teachers, 200 of our personnel. And they are scheduled for the second shots coming up. It was the Moderna, as he mentioned, so 4 weeks from last Tuesday, we'll have a second clinic for them. We've had a conversation. We're looking to have more clinics. Again, just as we had our nurses set up to be doing the contact tracing, our nurses have been trained to be able to give the shots, and we will work with the county on continuing to make arrangements and helping in any other options that we can with that. So that's where we are right now, and we're looking forward to seeing it move forward. Any questions?
Yes, I have. The data that we see all the time is data based on the population as a whole, which I'm assuming is what you've provided us here. I'm curious what that data looks like if you extrapolate just the school-age population.
Well, we do have some data that has been reported, and the one chart, the two charts that I showed that actually had two, well, I'll see if I can go back to it. Can you pull? Yeah. These charts, the light blue is staff and the dark blue is students. And so we do have an increasing number of students in January. I mean, through the year, we had evidence of students who had contracted or were in quarantine because of it. This particular one is showing the one of students who had cases, then the dark blue, and this one showing ones that were in quarantine because of it. And this is month to month to month that's going there. So we do have students that were impacted as well. I don't have in front of me the total number, but it was a fairly significant number through the time.
Okay.
And that's data that we collected from them self-reporting.
And the recent report that I read coming out of the governor's office indicated that they wanted schools to be back in person by March the 15th. Is that a mandate or a suggestion?
It's a suggestion, and it's a general suggestion. It's one that it says we recognize that students are probably better off, and we know they're better in school as far as instruction is concerned, because for most students, virtual education has not worked well. So it's there to say generally it is very important, and there are schools. In fact, I would say most schools throughout the state, most school divisions throughout the state have been virtual most of the time. We opened up for elementary, we opened up for our students with special needs and others, and had plans for the secondary, and will be opening up for the secondary. But they're still giving parents that option, and this concerns me greatly, because we have a significant number of parents who are choosing virtual education, but they're not doing their part at home to support this. There's actually a bill in the General Assembly now that says both, that schools need to be providing an education for those who want to come and providing an education virtually for those who want to stay at home. Well, we are providing both. I'm pushing the school board to work with my recommendation that persons who would choose to be fully virtual must show evidence that they're making progress with virtual education, or they need to come back to school. Because we're still looking at 30% or so of our students who would choose to just remain virtual and not make good progress. So we need to get those persons back in place. But it is working out. Maybe 10% of the students are taking advantage of it and really doing a good job and would choose to remain virtual. And for those, we're looking from a regional perspective on how we can provide that without having an impact. I will tell you, for our teachers to have some students virtual and some students face-to-face is double teaching, and it's practically impossible. It's burning our teachers out. And that's one of the reasons that we're going to be looking to have a way of taking care of those who want to be virtual, teachers that would only deal with those as opposed to the others. Right now, we just can't do that. There's too many numbers.
All right.
So we're still talking about bringing elementary schools back the 15th, not no high school kids, is that?
No, we will have high school students, secondary, middle and high school students coming back as well on February 15th, next Monday.
Well,
That'll be on an AB schedule, so it's alternating weeks. Elementary will be every week, and special needs children and ESL students will be every week.
Well, if this materializes that we can bring them back, and hopefully soon, do you think you'll have enough bus drivers to get them there?
We are working on that. We have sent out surveys. There are thankfully numbers of parents who are anxious enough that they've said, I don't care if you don't have a bus, I'm going to carry it. And so we're taking advantage of that.
That kind of feeds into my question, or with that February 15th date looming, are you seeing an uptick in virtual students wanting to return to the classroom in elementary?
We did have a significant number that came back and said they want that. And we have had to, the guidelines of the CDC and others in the classroom still says they would prefer a 6-foot distance with masks. We've had to move that to 3 feet apart with masks in order to be able to take care of the students who are wanting to come back. We had been 6 feet, no problem, but now we've had to move that back to 3 feet in the classrooms.
Okay.
Mr. Nixon, do you have a rough number of how many employees you still have that want the vaccine?
Yes, I can give you some pretty specific numbers. When we first put the surveys out of all of our employees, I'll let you know there are 807 persons that we have that we pay monthly for whatever service they're providing. And all 807 got that first survey. Of those, we had, at the beginning, the first survey, 385 who said they would choose to take the vaccine when they came back. As you noted, that's not quite half. Since then, since we've given the first vaccine, we have had that number increase. I do not have a final number, but I'm one of those, and again, I want to appreciate Wayne's support and Bobby's support and trying to push for this. We will take 200, 400, we'll take whatever we can get, and we're not going to waste any of them. We didn't waste any of them. We'll find people to come in. We make a schedule that runs smoothly. It ran really well. And we will find the people to come in and make sure that nothing's wasted, but it'll be our folks.
Okay.
Well, the teachers that choose not to take the vaccine, how do you handle that? I mean,
It's a choice they make. We can't force them to do it.
but they kind of endanger the rest of them when they come back to school.
Well, please keep in mind that the vaccine doesn't prevent you from getting COVID. It just eases the symptoms if you get COVID. So the issue there is anybody with vaccine or without, any of our teachers, any of our aides, any of our bus drivers could still get it. But if they get it, then they're still following our guidelines on social tracing. And so we continue to quarantine and we continue to do the health and safety checks, and they don't come to school if they're showing signs.
Okay. One last thing I read just the last couple of days that I can't remember I don't even remember who it came from now. It may have been the Department of Education. I'm not sure that probably a lot of the students probably need to repeat this year in school. What's your feelings on that, and what?
Well, certainly the governor has actually been calling that year-round school. And there are some school divisions that may be looking at year-round school, but I'd like to actually give you a definition right now of a year-round school. Right now, students, by guidelines from the Department of Education, are expected to be in school 180 days a year. Okay? So a year-round school simply takes that 180 days and spreads it evenly throughout the year, as opposed to giving a long summer break. You get 3 to 4 week breaks every quarter. And in that scenario, you're not really giving additional time for students to be able to catch up. What we're looking at is, and we will be looking at creating a very significant after-school remediation program as we have students come back in, as well as summer school programs for remediation to help them keep up. Now, that requires teachers working extra, and you have to pay them for the extra because they're under contract for what we pay them. Fortunately, with the second stimulus money from the federal government, Mecklenburg will be getting an additional $5 million, a little over $5 million. And most of that money will be spent on the remediation activities that we have to pay the teachers and to provide for the bus drivers and the cafeteria staff and everybody to be able to do the summer work. And there again, I will be asking the board to support me in making statements that if a student is not at grade level or has failed significant numbers, they will be strongly, I want to say required, but it's hard to require things of parents. We will be requiring them as strongly as we can to have their children come and participate so they can get caught back up.
All right, okay.
Any other questions?
Any other questions? Well, we thank you for coming. Thank you for the update.
Thank you.
All right. Okay, Budget and Finance Committee report, Mr. Spain.
On Budget and Finance Committee report, I assume that each person has his or her copy. You have one motion on this report. The Budget and Finance Committee met Monday, February the 8th, 2021 at 8 a.m. in the Board of Supervisors conference room. Present, Mr. Jones, Mr. Brinkley, Mr. Jennings, Mr. Wilkerson, and myself. The chair called the meeting to order. The Sheriff Department have received an insurance check for $500,000. I'm sorry, for $500 for a recovery fund from the third party. The staff have requested the fund to be supplementary appropriate to the vehicle repair line item of this budget. Upon the motion of Mr. Charles Jones, the committee unanimously recommend the approval of $500 supplemental appropriation to the Sheriff's Department. The chairman would like to make this in the form of a motion to accept this $500 appropriation.
Okay, you've heard the motion in the discussion. All in favor say aye.
Aye.
Opposed? Thank you.
Next, Mr. Carter, next review the upcoming FY 2021 and slide 2022 budget. He stated that the school system is going to need an addition $1,443,673 for the debt service for VPSA bond. Also, the school are required step increase for their employees. Each step equals the appropriate 2.9%, as well as an addition employees. Addition fund of $1 million would be needed to add 2 or more convenience centers to the 2 currently in the budget. Staff will also be looking at an addition deputy administrator and another IT employee. The county would need to fund demolition for the Buckhorn Elementary School as well as the house next door to the Good building. Also, the new budget will include funding for reserve of $27,680,000, depending upon the final cost of the construction of the new school. Mr. Carter stated he is concerned about expense change order that will cause construction costs going over budget. Finally, minimum wage will decrease $3.75 per hour over the next year, which will begin salary compression on the lower end of the scale and increasing to $15 an hour over the next 4 years. The staff is recommending a new salary scale study be performed to address this issue. The funds for the Atlantic Coast Pipeline will be ending this year as the pipe is currently being removed and funds is selected. Enforcement will be low at a 50%. Health insurance is expected to be a 5% increase. Fire and rescue will more likely request additional funds. There be no more business. The meeting was adjourned. So the chairman, this concludes the report of the Budget and Finance Committee.
Okay, all right, thank you, sir. All right, Economic Development Report, Mr. Jones.
Yes, the Economic Development Committee met on Monday, February the 8th, 2021, at 8:30 in the Board of Supervisors meeting room. Members present, myself, Clancy Spain, Jim Jennings, and Tom Tanner. Others present, Glenn Barber, David Brankley, Claudia Lundy, Andy Hargrove, Sterling Wilkinson, Wayne Carter, County Administrator, and Angie Kellett. The chairman called the meeting to order. Mr. Carter presented the bids received on the 500,000-gallon elevated tank at the Timber Campus. 2 bids were received, with the low bid from Caldwell Tanks Incorporated of $1,771,000. Upon a motion by Mr. Tanner, the committee unanimously recommended award to Caldwell Tanks Incorporated. Mr. Chairman, I'd like to put that in the form of a motion that we accept the bid from Caldwell Tanks.
Okay, all right, you've heard that motion. Any discussion? All in favor of the motion, say aye. Aye. Opposed? Thank you.
Ms. Kellett reviewed a proposal from Timmons Group for engineering study to be performed at the Kennerton Technology Campus. Currently, this site has been classified as a Tier 3 site and needs to have additional topography, wetlands delineation with the preliminary jurisdictional termination by the Corps, Phase 1 environmental, etc. This will enable the site to be certified as a Tier 4 or 5 and continue to be marketed by VEDP. The cost is estimated at $56,000. Staff is requesting that the board approve this project and authorize staff to apply for Tobacco Commission funds for 50% of the cost and remainder coming from the county IDA funds. Upon a motion by Mr. Tanner, the committee unanimously recommended the approval of the project and for staff to apply for the Tobacco Commission grant. I'd like to put that in the form of a motion, Mr. Chairman,
Okay.
that we accept that.
All right, you've also heard that motion. Any discussion? All in favor of the motion, say aye.
Aye.
Opposed? Thank you.
And that ends this
Okay.
committee report.
All right, thank you, sir. Okay, Property Committee report, Mr. Jennings.
Thank you, Mr. Chairman. The Property Committee met on Monday, February the 8th, 2021 at 8:45 a.m. in the Board of Supervisors meeting room. Members present, Jim Jennings, Chairman, Andy Hargrove, Claudia Lundy, Clancy Spain, Sterling Wilkinson. Also present, Glenn Barber, Charles Jones, Tom Tanner, David Brankley, Wayne Carter, Judy Sheffield. The chairman called the meeting to order. Mr. Carter presented bids received for the relocation of the Confederate statue on the courthouse square. The low bid was received from Safeside Grave and Vault Incorporated for a cost of $60,300. Upon a motion of Mr. Spain, the committee, by a vote of 3-2, recommends approval of the low bid. Supervisors Spain, Lundy, Hargrove voted aye, and Supervisors Jennings and Wilkerson voted nay. And Mr. Chairman, at this time, I will defer to one of my committee members for a motion.
Mr. Chair, so move. Mr. Chair, so move.
Okay, all right. Ms. Lundy has made the motion that we accept the
Lowest bid.
the lowest bid of $60,300. Any discussion on that motion? All in favor of the motion, say aye. Aye. Opposed?
No.
No.
Okay, 3 opposed. Motion carries. Okay, thank you, Mr. Jennings. Continue.
Mr. Carter reviewed the proposed invitation to bid specification for demolition of Buckhorn Elementary School. All metal and inert materials, brick, concrete, etc., will be recycled, and all other non-recyclables will be disposed of in the SRPSA regional landfill, with the county paying these tipping fees directly. Staff expects to have bids back in March and award in April by the board. Upon a motion of Mr. Wilkerson, the committee unanimously authorizes staff to advertise the project as proposed. And at this time, I present that as a motion to go ahead with the demolition of Buckhorn Elementary School, Mr. Chairman.
Okay, all right. You've heard that motion. Any discussion? All in favor of the motion, say aye.
Aye.
Opposed? Thank
There
you.
being no other business, the meeting was adjourned.
Okay. Thank you. Mr. Carter.
Yes, sir. I have the building permit report for the month. Again, 10 houses. That is a fairly low month for us. But you will look at the cost of those. Average cost is roughly $350,000. We estimate probably the real cost that we're averaging across the board for new houses is about $500,000. Would you agree, Mr. Taylor? Which is extremely high for our area compared to what it used to be and for our region. So we're still up with regards to that. You've got zoning permits are up. For the month, you have animal control was able to adopt out of return over 80% of the animals that they picked up this past month. The sheriff's report is here, both for traffic and summonses. If you have any questions on that, the sheriff is here. We did do over 3,100 calls for service last month. 2,150 businesses were checked. VDOT, again, you've seen them. We have had some snows. They have been taking care of those and also working on the various roads throughout the county. If you have any questions on that, you do have a report from Southside Behavioral Health, what was Community Services Board, with regards to what has happened over the last month. We are getting this monthly. They have submitted their budget request, and they are requesting that if they can, that when we do budgets, that they are allowed to appear. If you have any questions with regards to Beth and her staff on that one. John Taylor's here with regards to a COVID update.
Good morning.
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 So just like normal, actually this time around, I'm happy to report that we're dropping in numbers at the moment. Knock on wood, though. Because last week, at one point last week, we were roughly 218 active cases, which is the highest we've had outside of having outbreaks. So it's all mostly community spread. And today, we have 132 active cases. So we've had a lot of big numbers drop off and a lot less come back on. We're still at 46 deaths. And as far as the vaccination goes, some a little bit higher numbers than what Dr. Spillman gave you, because this came in as he was talking to you guys. For Mecklenburg, first doses, we've had 4,388 first doses, and second doses, we've got 724. A lot of that has to do with the pharmacies coming in and doing the nursing homes in the very beginning. And so that upside numbers is a little bit, came from a different base than what we have as a county or what they have as a health district to give out. Here locally, I don't know the numbers that the individual doctor's offices have been able to give out, but I know that health department wise, we've been getting roughly about 100 to 110 doses a week. And they've been covering everywhere from starting off with EMS, then to fire, and then police, and then working way into county staff. And along with that, as they were doing that, they were also bringing in certain numbers of non-affiliated healthcare workers, dentists, pharmacies, and things like that. So that's where our number is where it is at the moment. I don't know, you guys have any other questions? I know last week I did meet with, I've had some talk with the Virginia Department of Emergency Management. Of course, they put us all on a regional meeting, and we talk about the vaccination sites, possible state vaccination sites. And they're gonna range in size from small to medium to large to what they're gonna call mega sites. So kind of like the Richmond Raceway thing you might have seen on TV. And a small site would be able to do like 250 doses a day. A medium site, 1,000 doses a day, and then up and just keep climbing until it gets to about 6,000 doses a day, I think, for the mega sites. I'm actively pushing to hopefully get something like that in our area, but sometimes that doesn't look good just because of where we're located at. So when Mr. Spain asked to get those additional doses for the resolution, you know, we may want to, I don't know, push on them a little bit as well to see if we can land a site down here as well. We've been looking at different places where we can do those things, and we'll continue to work with the state to try to give them every opportunity to put one in our area to work with the health departments.
John and John have both been working on that, both in-person sites and drive-through sites.
Any questions, John?
Yes, sir. Ms. Taylor, how would individuals know when to come back for the second shot?
The health department usually notifies you that you're coming up to get a second shot. And I'm not exactly sure how their new system is going to work. They've been talking about the new system for a couple of weeks now. I'm assuming that would do the same thing, notifying you. The current system notifies you, but they also individually from down here at the health department office, they'll send you an email to remind you as well.
And it should have been on your card when you got your first shot.
Yes.
Okay. Any other
Just a comment, we did get an email from Mr. Carter indicating that maybe the school gymnasium might be considered. Is that something that could work in the scheme of things, a mega site?
It could do for maybe 1 or 2 days a week, but with the kids going back to school, I don't think it would be conducive to do it in a high school.
Right.
Okay.
And it must have cut me off, time limit.
David, stop doing that.
Yes, sir.
Yes, sir. When the schools were going to be closed, that's what we were looking at. But now with them coming back on their switching weeks, that will not work unless you had a Saturday time frame.
I will tell you the day that I visited the site at the school, the way they were running it, it was running really well with the amount of space they had and the staffing that they had to help out. And they did that pretty much all on their own, except for Bobby had some people there to help with, you know, security, and Julia Gwaltney from the health department was there just to oversee. So it really alleviated a lot off the health department to do that site the way they did.
Well, the community centers could be used for that purpose, you know, the VFW or the.
The thing of it's going to be, and I'll just tell you straight up, because I really think this is my belief, is that they're not going to be able to do them in every community. So it's going to be one of those things where I'm hopeful that 1 out of every 2 counties gets it to join together to do something like that, or 3 counties. But if that doesn't happen, then people from rural areas may be driving as many as 2 to 3 counties away to get it, and at a larger site. So,
and one of the things the state told John was also they're looking at something that they can run continuously week in, week out. So the issue with community centers, if they're used for anything else, that's not going to really work. They're looking for vacant spaces that they will have for 6 months straight. And you can't do that with a community center on a daily basis.
Correct. Yeah.
So this vaccine, I presume, will be like the flu vaccine. It'll have to be repeated annually. Is that correct?
I mean, if you, I don't know from anything that anybody specifically told me. If you watch the news, some people are saying that. Yeah. And then because of the different variants coming out now, they're already looking to change the design of the vaccine itself. So they say,
Well, I think the flu vaccine is kind of like that. Don't they like have to change that every so often because of the flu mutates?
Strain.
Yeah. Mm-hmm. But I guess what I was leading up to was if this is going to be where everybody's going to have to get this thing on an annual basis, after this first round and we get people vaccinated, the normal channels going to be able to handle these vaccinations going forward into the future? When I say normal, I mean like doctor's offices and stuff like that, or?
My assumption would be if they can produce it to the amount of effect that they need to, or the amounts that they would need, that it would be just like the flu shot. If they can handle that, should be able to handle that as well, I would guess.
Okay.
I hope.
Well, that's what I was going to say. I mean, is this something we're going to have clinics every year to vaccinate folks? That was what I was kind of getting at. So
yeah.
Okay. All right, any other questions, John?
Yeah.
Thanks, John. Appreciate it.
Then our mask can come off.
Just comment, Mr. Chairman, a motion made early concerning, resolution to request more vaccine for this area could be added to that motion to act for a mega site or in Southside or Mecklenburg County. Could that be somehow
We can ask for a
requested?
site. We're not really equipped for a mega site.
No. Okay.
A medium site.
A tri-county site.
Yeah, we'll ask for a site in that also.
Just say a tri-county site or something.
Yeah, the three
Okay.
counties in our Southside Planning District.
Yeah, that's something we'll investigate.
Okay, thank you.
Okay, thank you.
And maybe incorporate into it, the governor's, not mandate, but the March date that he wanted to have the school teachers supposedly vaccinated as the reason we want these extra doses.
Yes, sir. Yes, sir. No problem. We'll be glad to do that. Finally, website update. We did have our kickoff meeting last Thursday. Based upon the time frame, we hope to launch the site on the week of July 9th, or roughly that time frame. So we're moving forward on that project if you have any questions.
Any questions on that?
Wayne, is there a way that we're gonna be able to give input to that?
We've got a group of staff members. Basically, it's going to be each department will be updating their own system.
Right.
So you'll have it with regards to our staff, but we're going to be leaving it up to each department to what they're putting on their content and who will be their people updating it.
Okay.
All right. Okay, we have to make a couple appointments this morning. Number one is to fill Mr. Pete Rudd Jr.'s seat on the Mecklenburg Brunswick Regional Airport Commission. We need to go ahead and get this taken care of.
Yeah, Mr. Chairman, I would like to nominate John Taylor for the fulfillment of this position on Mecklenburg Airport Commission, please.
Who?
John Taylor.
Oh, okay.
Our very own John Taylor.
John Taylor.
Anyone have a nomination? We have a motion to nominate, appoint Mr. John Taylor to the Mecklenburg Brunswick Airport Commission. Any discussion? All in favor, say aye. Aye. Opposed? Thank you. All right, next, Mr. Landon Hayes, that serves on the Southside Planning District Commission. Their bylaws require that you can't miss more than 3 consecutive meetings. Unfortunately, Mr. Hayes has had to do that or has done that. So his term is due to expire on the 31st of August 2022, but I guess we need to take some action on that.
Mr. Chairman, I spoke with Mr. Hayes. One of the issues he runs into too, he's also on the Mecklenburg Planning Commission, and a lot of times they meet the same nights.
Okay.
So I spoke to him about this, and he totally understands. He's fine with it. And the Southside Planning is also trying to have all 3 of the county administrators on the board or as a commissioner. Mr. Carter is the only one that's not, so I would like to make a motion that we put Mr. Carter in to fill Landon Hayes' position.
All right. Motion to appoint Mr. Carter to fill Mr. Hayes' position on the Planning Commission. Any discussion?
Mr. Hayes has done a real good job on the Mecklenburg County Planning
Good.
Commission, and just, not that he's not doing a good job, it's
Well,
just a conflict.
that's right.
of
That's
conflict right
that's
there.
a conflict. That's
Yeah.
right. Yeah. So, all in favor of that motion, say aye.
Aye.
Opposed? Yeah, Mr. Carter, you can do that in your spare time.
Yeah.
That's an as needed.
Free time.
Okay, you have in your packet the Roanoke River Service Authority minutes of their November meeting. That's for informational purposes. You also have the consent calendar in your packet. Hope you've had an opportunity to review that. Need a motion to adopt the consent calendar.
Chairman, I motion to adopt the consent calendar as presented.
You've heard the motion in discussion. All in favor of the motion, say aye.
Aye.
Opposed? Thank you. Okay, that brings us, that's the end of our regular agenda items, brings us to our public comments session. Mr. Carter, do you have any?
No, sir, we received no comments, sir.
Okay, we've received no comments, and here again, we're sorry we can't entertain our folks here at these meetings, but soon, let's hope. Okay, let's go to board member matters. Ms. Lundy, you want to start us off?
Yes, I will. In addition to Mr. The superintendent, about the failing students and having summer school this summer, and also remediation after school. I thought that was a good idea. And I think you should also send letters to the parent of these failing students just to remind them, because they'll probably say, you know, I didn't know about this. If these students are failing or behind, to send letters to these parents so they can prepare themselves. Thank you. Thank you.
Right, thank you. Mr. Jennings?
Thank you, Mr. Chairman. I want to thank Mr. Spain for the resolution. I had actually thought about that while Dr. Spielman was talking, but I think that's absolutely necessary that we try to get more vaccines in there. If that help, certainly not going to hurt anything sending that. Just want to, at the last couple of meetings I brought up about what the General Assembly is doing with legalization of marijuana. Just kind of wanted to bring everybody up to date on that. I talked to a lobbyist at Farm Bureau, and they've gotten down to one House and one Senate legalization bill. Has been looks like it's going forward, and there's 100% chance that it will pass. I'm not endorsing it. I'm just giving you an update, and it will be fully legalized by 2024, from what they're saying. So here we are.
Here we are.
You know, these times just keep on giving, don't they?
Yeah.
Anyway, that's all I have, Mr. Chairman.
Okay, thank you. Mr. Franklin?
Well, yeah, I would certainly not condemn, I'm sorry, Mr. Nichols, commend you on the job you're trying to do. But, you know, the challenge you have before you to try to get these kids into school, and, you know, some of the questions I get, okay, you know, and listen to that, 30% are not doing nothing. You know, and those kids, when you do get them back into school, you know, the kids are here working hard, trying to get that virtual learning done, or actually other ones going to other schools. You know, the challenge is them coming back, and then these 30% back in the classroom, you know, get them behind or whatever. But, you know, it's no fault to the kids. The sad part is what I call non-responsible parents that's not reacting and getting that job done, and how important that is. And like Ms. Lundy said, send her letters, and I'm sure y'all have reached out numerous times because you want them in there as bad as you can. And also, what a challenge, and the challenge going forward once we get these kids back into school. You know, looking at like on the state level, you know, whether you're a Democrat or a Republican, you know, drawing these maps of redistricting, and we potentially losing seats and people that represent us down here in Southside Virginia because our numbers are going down, you know, and that should be a concern to all of us, not to lose these people that walk on the same soil and all that we do, that go ahead and reach out and try to help us get things into our counties and stuff like that, and do that. And then even on the, you know, on the national part, you know, of course, we talking about budgets. We work hard to try to hold our taxes down for our citizens and all and stuff like that. And, you know, it looks like our new administration there in Washington today is really on a spending spree, you know, and, you know, this stimulus package, we need it, you know, a lot of that money, but a lot of it looked like it's not necessary. That, you know, everybody likes to get a check, but someday somebody got to pay for all these, you know, whether they're kids or whatever. But, you know, they'll always say, well, it's not going to be no tax increase to poor people and middle class people. Well, have you been to the gas pump lately? Have you bought any propane or fuel for your heating lately? You know, been to the grocery store. I mean, I heard the other day fertilizer is going to be up 30%, you know, because of just stuff that goes up. But remember, you're not being taxed. You know, you're not getting a bill or ring for the tax, but you are being taxed. real big. So, you might get a stimulus check for $1,400, probably gonna need every penny of it to pay your tax, these taxes that's coming along the line here. But, just be aware that when it sounds so good, it's not really that good, looks like to me. That's all I got.
All right, thanks, sir. Mr. Hargrove.
Thank you, Mr. Chairman. Back to school is kind of confusing, and I understand it is very stressful. From every aspect of operation, it is stressful, and I wouldn't have your job at all. I looked at you from December to now, and I'm saying to myself, I said, Mr. Nichols is doing well on this diet, but after talking this morning, I think stress has gotten you to that point. The next thing is that I read about one of the members of Mecklenburg County in the newspaper who has reached the milestone of 107. Mm-hmm. And it is astronomical to hear people to live that age. And I think we recognized her 7 years ago. And also we recognized Mr. Sizemore as well a couple of years ago. But I'm just glad to see people that reach that age to be members of Mecklenburg County. Also, there's a lot of that's ahead of us as far as our county operation. And Mr. Carter, I personally want to thank you for being such a diligent overseer of our direction and your staff. And I'm telling you, we have much to look forward to. We have many challenges to hurdle when we get to that point. And right now, the county, the states, and the world is anxious for this vaccine. And I don't know how we're going to overcome, but we need to obtain one of those virtues called patience. And maybe one day, when they finalize that new drug, I guess that's what you was talking about, Mr. Jennings, when they finalize that new drug, maybe to bring about some patience, me and Mr. Brankley can sit down with a smoke pipe and come at peace with it. That's all I have, Mr. Chairman.
I'm looking forward to the further section.
Oh, man. Mr. Tanner.
Thank you, Mr. Chairman. First, again, to Mr. Nichols, thank you and your staff for all y'all have been doing. Y'all have got a thankless job right now. I know with virtual learning, in-person learning, all the kids need to be learning, but it's a tough time to be a teacher or any school employee right now, so thank y'all for what y'all do. And the General Assembly, there's so much stuff going through there. I know I spoke with Wayne the other day. Our solar lobbyist we hired has been busy too, because there's been several bills that they've been working on this year to make sure that it's the best outcome for the counties and all. Also, John Taylor, thank you. Behind the scenes, you have done a lot for these vaccination sites. And I personally want to thank you and thank you from the county, because I know you have done a lot to make sure that vaccines get into any arms that they have vaccinations for. So thank you again and keep up the good work. And just, Bobby, your office too, and the fire and EMS, thank y'all. And what Mr. Hargrove said about somebody that's reached a milestone of 107 or 102. Just to think of the changes those people have seen in their lifetimes, to go from probably no electricity, outhouses probably in a lot of situations, to everything we have now. So I just think it's amazing, and you kind of want to talk to them too, to say, okay, give me your aspects over change, because I know change is hard a lot of times, but just the things they've seen in their lives have probably been amazing. And just thank Wayne and all our county staff. I know Wayne's probably aged a few years too, just like Mr. Nichols, because there's been a lot going on, but thank y'all again for everything y'all have done to keep the county functioning. That's all I have, Mr. Chairman.
All right, thanks, sir. Mr. Wilkins?
Thank you, Mr. Chairman. I, being about the fifth one to go here, most of my points have been taken as usual, but just wanted to hit on about the 80% vaccine rate. I, like you, feel like that's a little high, unfortunately, but we really need to do all we can to get to that. You know, I think it's always a good idea to have a lofty goal, and if we get close, you know, we do the best we can. But, you know, everyone should look into that the best they can, because herd immunity really is the only way around this at this point, what I understand by my reading. So we all should do our part with that. And then another figure was kind of interesting to me was that 30% of the parents still want their kids full virtual. 30% is a lot. I mean, everyone that I talk to and know of, get them back, you know, immediately. But I mean, almost a third of, you know, I couldn't believe it was quite that high, you know, but, which to me creates more problems down the road, possibly, you know, to get them up to speed and other issues, which y'all have been navigating through. But y'all have done a great job with everything, you know, you've been dealt. But I am glad to see them going back next Monday. So we should be thankful for that. And finally, the Buckhorn School site, it's been a long time coming, but we've got it going. I understand the longevity of the process, but I was, you know, glad to see that we're gonna finally have some action in that department. So that's all I had.
All right. Thank you, sir. Mr. Jones?
Well, I'd just like to thank Mr. Neese for coming out and speaking with us and showing what Southside Planning District is doing and how that information is very valuable, and I hope everyone will take time to access the site to keep abreast of what is going on in the county and what the numbers actually are, including unemployment. You know, it's not just about the COVID vaccine. And I was very happy to hear from Mr. Nichols that construction costs are down. You don't usually hear that on anything. And the fact that it's down, I don't know how much it's down, but it still sounds good. And, you know, I've got the same concern that Mr. Brinkley has about the energy situation in this country. You know, the big rush for solar and wind, which makes, 3 to 5%, when people don't really realize that has to be backed up with gas or some other form of energy, that it's not as reliable as people think it will be, because it has to be backed up, unless there's some super batteries, of course, that can be stored or something. And I believe this country needs to remain energy independent. And if it comes down to having pipelines running somewhere, it's a whole lot better than having a tractor trailer going down the road in all these communities where all these children playing out in the yards and what have you, and the accidents that could happen. Just let your mind work on that a little bit, and you can see what I'm talking about. And just like to thank all the staff for all they've been doing through this whole virus. I really appreciate what they do every day. That's it.
Thanks, sir. Mr. Spain?
For the board, a lot has been said today, yes. We look at monies, we look at the budget, at that slowly unfold, and you're right, Mr. Brinkley, if the government could come down and look at Mecklenburg County, she spend money after she get it, not before. It would help all of us. Nothing free. Their debt gonna have to be paid one day. And we're gonna pay some of it too. So at the county, we keep looking at what we need, and not all the time what we want. But we're looking forward to the budget process to be successful, and thank the staff for laying out a kind of vision for us as we move forward. Thank you, Mr. Chairman. That's all I have.
Thank you. Yeah, Tom sort of alluded a minute ago to sort of the older days and times back, and I'll never forget one time I made the mistake of saying something to my father about the good old days, and he said, well, let me tell you about them good old days. He said, I can remember as a boy stepping out of my bed into snow in the morning. He said the wind would blow so hard I could walk up under the linoleum. So, he said, as far as I'm concerned, right now is the good old days. I've got heat and air conditioning, and so anyway, that was his view of the good old days. So, and you know, I've always said that I'm just so proud of living in this county and in this community. And nothing bolstered that any more than what occurred this past weekend in a fundraising event that was held for a young man that was critically injured in an automobile accident. He is now in Atlanta, I believe, going through rehab. And obviously, this has devastated his family, both emotionally and financially. Anyway, a group of wonderful citizens got together and decided to hold a fundraiser for this young man's family this past weekend to help them out with their situation. And they raised $28,000. $28,000, which will go a long ways in helping this family. So that's the kind of community that you live in, and that you can be very proud of. I know that I am, and all the people that were involved in that fundraiser, I want to publicly thank you for all of your efforts. And it was quite an undertaking. So, all right. Any other comments? If not, we have to go into closed session to discuss economic development matters, legal matters, and personnel matters. So at this time, we need a motion to go into closed session.
So move, Mr. Chairman.
Motion to go into closed session. All in favor, say aye. Aye. We are now in closed session. We'll We live? We back? Okay. All right, so we need a motion to go back into open session.
Mr. Chair.
We have a motion to go back into open session. All in favor of the motion, say aye. Aye. Opposed? Thank you. We're now in open session. We need a motion to certify our closed session business. We have a motion to certify the closed session. All in favor of that motion, say aye. Aye. We're now back in open session. There was nothing discussed in closed session that requires any motions or any actions on behalf of the board at this time. So does anyone have anything else they need to bring before this board at this time? I appreciate everybody's patience. I know your stomachs are growling, mine is. But thank you very much, and y'all have a great day, and we will adjourn until our next meeting on March the 8th, I believe it is. Okay, meeting adjourned.